Hello everyone, welcome to the second live stream for COVID Update. I'm your Mayor, Robin Ellicott. Today we have some special guests with us that we're gonna go over as a second COVID Update. So the speakers are Dr. Joe Anzandula and Dr. Mona Finley. We have our Acting Fire Chief, Mario Partida, and we have two of our City Council members with us. One is a Council Member of District B, Jeffrey Boney, as well as Councilmember at Large, Position 2, Lynn Clauser. As a former healthcare employee myself, I know how important it is to be safe and to have safety as a #1 priority. So part of these live streams are to make sure that we are being transparent with you as a community, to let you know what's going on and to keep you updated on some of the things that's going on within our city. Without further ado, we'll have our guest speakers come up and speak. We'll go in the order of Dr. Anzandula, and then we'll have Acting Chief Mario Partida, and then Dr. Mona Finley, and along with Councilmember Jeffrey Boney, as well as a large Councilwoman Lynn Clauser. And we will have Q&A at the end. Just make sure that you're writing those questions in the comments so that we can get to you and we can answer as much as we can. If we don't have the answers, we'll make sure that we'll find them and we'll get them to you. So without further ado, Dr. Joe.
Thank you, Mayor, and good afternoon. COVID-19 remains a threat to our community, as evidenced by the increased positivity rates we are now seeing in certain areas of Fort Bend County, including Missouri City. The county continues to remain at coronavirus threat level of red, which is the highest level of community risk. There are also two variant strains that apparently started in the UK and South Africa, but has now found its way into the US, including 2 cases in Houston that we know of. Current data indicate that the UK variant has the potential to increase the US pandemic trajectory in the coming months. In fact, the CDC projections indicate that the UK variant will probably become the dominant strain by March. How this will impact on vaccinations is less certain. So it appears that our current vaccine do provide immunity against these 2 strains, but to what degree still remains uncertain. So we must all continue to take all the necessary precautions to stay safe. Now is not the time to be letting our guard down. The increased transmissibility of these new variants require that we continue compliance with public health mitigation strategies. So again, remember the 3 W's. Wear a mask, properly fitted to your face, covering your mouth and nose. Number 2, wash your hands, soap and water, or hand sanitizer at least 60% alcohol. Number 3, watch your distance, at least 6 feet apart, especially from non-household family members. Just a word on vaccine allocation and distribution. Vaccine availability continues to be a concern locally. The state of Texas determines allocation throughout the state. The good news is that there is more coming to Fort Bend County. Recently, the state of Texas started organizing large hubs. So hubs are community-based vaccination centers where the local health departments, such as Fort Bend County and Harris County health departments, in conjunction with other healthcare stakeholders, are working together to vaccinate a large number of people as soon as possible and as soon as vaccination is available. A hub site is currently being organized here in Fort Bend County as we speak. The state recently reported that an additional 332,750 first doses of COVID-19 vaccine will be delivered to over 200 facilities across Texas this week, including the over 80 hub providers I just mentioned. The state has also ordered a little over 250,000 doses earmarked for the second dose. So right now, efforts are still being made to give priority to healthcare workers, first responders, residents and staff of long-term care facilities, such as nursing homes, individuals 65 years and older, and those with medical conditions. So all those groups are in phase 1A and 1B, and that's currently what we're involved in right now. It appears that the other phases, including 1C, are not going to be able to be rolled out probably until early summer. But this may change as federal guidance is currently being developed. The City of Missouri City continues to work with regional healthcare authorities to ensure that we remain informed of issues that impact the safety of our community. This includes the distribution of vaccines as they become available. It's important that as many people as possible take advantage of COVID-19 vaccines when they do become available. As you know, the first FDA-approved vaccines are now being provided to first responders, as I mentioned, healthcare workers, et cetera. To ensure the effectiveness of these valuable resources and create the herd immunity that we hope will protect our families, we must get vaccinated unless you have severe allergies to injectable medications or your doctor tells you otherwise. I know many are asking if the vaccines are safe. I still believe the answer is a resounding yes. So here are a few things to know about the current COVID-19 vaccines that have recently been approved by the FDA. Vaccination is considered to be the most important and probably the very important tool to stop the pandemic. Although we only have 2 vaccines that have been approved under the EUA or emergency use authorization by the FDA, there are many more being developed and are awaiting approval. The vaccines are free and there are no associated costs. Currently, there's a limited supply of COVID-19 vaccine in the U.S., but production and distribution is starting to ramp up in the next few weeks and months. Currently, the 2 approved vaccines, Moderna and Pfizer, is a 2-shot series, and the reported 94 effectiveness is still achieved, will not be achieved until both doses have been administered. So the second dose of the vaccine must be given within the specified time frame after the first dose. Please consult your healthcare provider for specific guidance on the vaccine that you are getting if any questions or concerns. Vaccination is still recommended even if you have already had COVID-19 and have recovered from it. Since the current vaccines do not use live virus, you cannot get COVID-19 from vaccinations. After COVID-19 vaccination, you may experience some mild side effects such as a sore arm, headache, fever, or body aches. For most people, these side effects do not impact their daily activities such as going to work or going to school. Symptoms should resolve in a few days. Again, the vaccines are safe. There is some good news. The seasonal flu is showing that there is substantially low rate. So this is a bit of good news in the middle of this COVID-19 pandemic. It is felt that our public health mitigation efforts, the 3 Ws that I talked about, that we are doing to prevent the spread of COVID-19 are paying off and slowing down the spread of the flu. In addition, there has been an increase in flu vaccination rates, which has also helped. So if you still haven't gotten your flu vaccine, get one if you are eligible. Remember that the more people that get the flu shot, the less chance of getting it, and also reduce the need for hospitalizations, thus opening those beds up for people who may become seriously ill with COVID-19. If you want more information regarding the coronavirus or vaccination availability, I would direct you to the Texas Department of State Health Services website, www.dshs.texas.gov. And the other bit of good news is that current data in Fort Bend County seem to suggest or indicate that the virus may be slowing. The positivity rate is going down. The fatality rate is also going down. ICU bed usage is slightly low compared to last week. So everything is trending to the idea that things are getting better, maybe. I think it's still too early to make a definitive judgment, but the projections are looking that way, and hopefully that's the case. Thank you.
Thank you, Doctor. Just want to let everyone know that I want to take this opportunity to thank Dr. Anzaldúa because he has taken a lot of time in doing the research and doing all this work and be available to Missouri City at any time that we call him to. The next speaker is going to be our acting fire chief, Mario Partida. He has also worked very hard in making sure that on several of the calls that he and I attend together to within state as well as county to make sure that we're keeping up to date. He will come and speak to you all about what's going on with Missouri City, more so with staff and emergency operations. Chief.
Thank you, Mayor. The Emergency Operations Center remains activated at a level 2, and what that means is that we meet weekly. The staff from all the departments meet weekly remotely to manage several things. One is we review the weekly data, the cases that are occurring in Missouri City, and then we also look at our PPE levels to make sure that we have adequate PPE for your first responders that are out available to help you in your time of need. And then we also look at service levels, if there's any service level impacts to any of the departments. And then, of course, our focus right now has been on vaccinations, and that is twofold. First is we want to make sure that our first responders that are here to help you are vaccinated. So on that front, we have vaccinated 100% of the fire and police first responders that wanted the vaccination. We have an ongoing list. If more come on board or want to get vaccinated, we get them scheduled. And then we'll be moving, once the phases that Dr. Nzadua mentioned evolve, we'll start vaccinating other frontline workers like public works and staff in parks that are engaged with interacting with citizens. But we want to make sure that we're taking care of your first responders so that they're ready to respond in your time of need, and that they're healthy and ready to help you whenever you call 911. The second part is our community vaccinations. Is we're trying to stay ahead of providing you all the information we can. And as Mayor mentioned, he and I participate in a weekly mayor and judges conference call at the state level. And then our emergency manager, Tamika Jewett, and I also participate in some county calls so that we can stay ahead of the information and the evolving vaccination for the community and how that's occurring. Right now, the city is not a vaccination provider, so our efforts are focused on making sure that we get as much information about where you can get the vaccination, and that's what we've been focused on, and Communications Department has helped us greatly in getting that information out and getting it posted. All the information related to COVID-19 on vaccinations is posted on our website. But we also understand that we have citizens that don't have access to those platforms or aren't comfortable navigating those websites. So we are also making available hard copies that we will hand deliver to your home if you need that information. We have a method in place where we will deliver no contact. We get your address and we'll leave it on your front porch or your step. But we want to make sure that everyone has access to that information. And I think Councilmember Clouser is going to talk about that a little bit. But we want to make sure that no one gets missed. And lastly, I want to go over the reminder cards. We implemented a reminder card for the second step of the vaccination. So the current vaccinations that are available require 2 vaccinations. And we want to make sure that our seniors have reminders to help them remember when to get that second vaccination. So our public education department and that officer is out at group homes, senior citizen homes, making sure that we're dropping off cards that remind them of that second vaccination. So we're doing everything we can to make sure that not only are we making information available online, but also in hard copy form for those that don't have access. There's other information on the website, such as these videos, if you want to look back at some of the information. But our focus right now, in addition to that, is to make sure that we do everything we can to support, as Dr. Nzadua mentioned, any hubs that might be developing in our area. We at Missouri City want to support any and all efforts to try to get a hub close to us. So we'll be working on that, and we'll bring you more information as that becomes available. And that is the end of my report, and turn it back over to the mayor.
Chief. Next, we have Dr. Mona Finley with Glen Lake Pharmacy. And again, she's someone that was here for our first a live stream, and we are going to continue to have her come back to make sure that we keep you on the community updated as to what's going on. So Dr. Mona?
Thank you. Good afternoon. I'm Mona Finley from Glen Lakes Pharmacy. So far we have vaccinated over 200 people with their first and second dose. We have pharmacists and nurses to help facilitate the vaccination clinics at the pharmacy. We currently have a wait list, which you can register at tinyurl.com/GLP vaccine. Please be patient. We are waiting from the state for more doses. Currently, we're not quite sure when we will receive it, but please be patient. Once we are notified, we will notify patients on our wait list in the order of their registry and priority groups. No walk-ins will be able to receive a dose that day. We have to work through our registry to be fair to everyone. If you have any questions about the vaccine, please come by or email us at CVD, which is coronavirus disease, GLP, Glen Lakes Pharmacy, @gmail.com. We're working very diligently to get the vaccines into the arms of patients, so please be patient. Thank you.
Thank you, Dr. Finley. And I just want to remind everyone, when we had the the hand sanitizers that was out when this whole thing broke in the community, it was Glen Lakes Pharmacy that was one of the first that had the hand sanitizers and was providing out to the community. And I do recall myself going out there and getting some for myself and my family as well. So we thank you, Doc. Next, we have our council member of District B, Councilmember Jeffrey Boney, to come and talk to us.
Right here. Thank you. Greetings, Missouri City. Hello, neighbors. This is very personal to me. Yes, I am Councilmember Jeffrey L. Boney for the great city of Missouri City, but I'm also a human being. I'm also a Missouri City resident, and I was also impacted by COVID-19 personally. Many of you may know or may not have heard that I was one of the first individuals in the region to contract COVID-19 and actually almost died as a result. I spent 9 whole days in intensive care unit after coughing up blood and not realizing that my kidneys had been impacted and all my other organs, and I was approaching heart failure. Thankfully, I was able to be seen by 2 of the best doctors and some of the best hospital staff in the area at that time, and was able to overcome COVID-19 and test negative for it. However, I was impacted as a result of it by being diagnosed also with a pulmonary embolism, meaning a major massive blood clot in my right lung. And so up until this day, until recently, that has been dissolved, but I've been dealing with that since March up until last month. This is real. I have my father's youngest sibling currently battling for his life right now in the same hospital and under the same 2 doctors who took care of me dealing with COVID-19, just getting off of a ventilator, but trying to recover. I also have many friends and associates who've passed away and that have negatively been impacted by COVID-19. This is real. This is not to strike fear in the heart of Missouri City residents, but to let you know that this is a real issue. And it's something that I've been on the front lines in the community through the Cure COVID Consortium and many other initiatives to try to educate, equip, and empower our residents and individuals all across the greater Houston area and across the country to let them know that they should take this very, very seriously. Make sure that you pay attention to everything that our local elected officials, our healthcare professionals have encouraged us, instructed us to do to stay safe. And I encourage you, don't use fear as your motivating factor, but make sure you use caution, make sure you use wisdom and prudence, because this is extremely important. I want to encourage all of you who are eligible to receive the vaccine to make sure you take that vaccine. Don't run away from it, run towards it, because it could very well save not only your life, but your family's life. And I just want to leave with this for many individuals who may be thinking to themselves, oh no, this can't happen to me. I had a friend of mine who shares joint custody with a son, and the mother ended up, unbeknownst to her, contracting COVID-19. When she found out about it, she didn't think that her 12-year-old son would be able to contract the virus. Well, when my friend picked up his son from that home and took him home, he ended up not only contracting the virus, but they took him to go see his parents, the child's grandparents, and they ended up contracting COVID-19 and ended up in the intensive care unit. This thing spreads, this thing is serious, this thing is real, and I just want to strongly encourage all Missouri City residents to please listen to all of the sage wisdom and all of the information that's been disseminated to you. God bless you, Missouri City, and stay safe.
Well, thank you, Councilmember Boney, for that personal experience that you shared with our viewers. I do recall seeing several of his Facebook posts as he was in the hospital. He was generous enough to be open about his experience and his COVID, where rather a lot of people aren't. So the fact that you're here today, you're representing the city of Missouri City, it is great, and we're inspired by your story, and we want others to listen to it so we can educate you on what needs to be done. The next speaker that I have is our council member at large, position number 2, Lynn Clauser.
Thank you, Mayor, and thank you, Councilmember Jeff Boney, for sharing your story. I'll leave it right there. Greetings, residents and neighbors of Missouri City. It was brought to my attention recently that one of our residents received his vaccine and realized that we need to do a broader outreach to our community. I appreciated this feedback and want to make sure that we do our due diligence in making sure we do everything that we can to ensure we are inclusive of all residents and taking into consideration in the different ways that you all receive information. I have met with our communications director, Stacy Walker, to cover the ways in which we will be ensuring that our residents are aware of updates. Every 3 weeks, Mayor Ellicott will host this live briefing, and if emergent information presents itself, you can expect more via this briefing. After hearing many of your requests, I have readily accessible COVID-19 and vaccine information. And we have worked collaboratively with Chief Partida and Stacy Walker with our communications team to ensure that the most up-to-date information is available on our landing page of the Missouri City website. Chief Partida will make sure that these updates will be provided and updated on a regular basis. So please make sure you stay tuned to our website on the landing page at the top. Our communications department is working directly with our homeowners associations to get them information so they can pass this information along to you via your HOA e-newsletters, printed newsletters, emails, and your monthly HOA meetings. HOA board members, if you are not receiving an update, please reach out to me at lynn.clauser@MissouriCityTX.gov, and I will ensure that you are kept up to date. Any limited community events that are taking place will have the information available on vaccines and any COVID information. And our communications department has committed to displaying the information on our digital messages boards around the areas of all of our city. Additionally, we will be investing in core plus signage for additional visibility to make sure that everyone stays informed. I solicited questions from residents yesterday, and a few that were posed and answered by our Fire Chief, Mario Partida, are as follows. Are there extra precautions that we need to take with the new variants of COVID-19? And Dr. Anzaldula addressed that, but I will address that again in case you're tuning in late. The city's Emergency Operations Center is closely monitoring the effects of the variant strains and attempting to learn as much as possible about them. He recommends continuing to follow the same safety precautions in place by masking, social distancing, and limiting exposure. The city's medical authority, Dr. Anzaldula, continues to work with us to keep us informed. Thank you, Dr. Anzaldula. Question 2, when will vaccines roll out in Fort Bend and where? Fort Bend County and Missouri City currently have registered vaccination providers who are periodically receiving vaccinations. The names of all of the current providers in Missouri City have been added to our city website. Also, Chief Partida and his team, as he stated, are making hard copies available for those with limited or no web access. Neighbors, we need for you to advocate for those of your residents and your family that are not able to get this information. If you can, or if you're one of those that needs paper copies, please call 281-403-4300 and get paper flyers with the list of the vaccination sites so that Chief Partida and his team can get those flyers to you so you can get those out to some maybe some neighbors that might need them. Question 3, is Missouri City in a position to secure vaccines for its residents? We are directing citizens to these registered providers that are listed on our website in Missouri City to sign up on their lists if you meet the open vaccination administration phases. And the last question, if I live in Fondren Park, am I eligible to sign up for the vaccine? Yes, please follow the directions aforementioned to sign up. I also want to make sure that the resources that our communications department has provided to us as a community, that we are tapping into those resources to keep informed. I am going to read a list of the various outlets that you can follow Missouri City. We are on Facebook, we are on Twitter, Instagram, YouTube, Snapchat, and Nextdoor. You can also download our Missouri City mobile app, MCTX mobile app, using the Apple Store or Android to stay informed. Again, thank you for allowing me to serve as your City Councilwoman at large position 2, and God bless you. Thank you.
Thank you, Councilwoman Lynn Clauser, for that update. And you can find all those information that she talked about on our Facebook page as well as our website. So please write a comment on it. We're coming down to our Q&A. So if there are any questions, please do ask.
Greetings, everyone. So I wanted to share with the speakers what the residents are saying to you all on social media. First of all, they're saying thank you all for the updates. Councilmember Boney, they're saying glad you recovered. Mr. Boney, prayers for your family. Mayor Ellicott, they're saying thank you so much for these updates and your leadership. So one of the questions that we have so far is how are we making sure that our golf course and city recreational center are safe for people to come and play and work out?
Sure. One of the information that we got from our city manager was that the golf course is operating at the 50% capacity. And they're doing everything they can to make sure that it's being safe. And we're following the city and state, more so state guidelines to make sure that the golf course and anyone that's coming there to play golf or coming to the grill to eat, it's being taken care of, it's being sanitized, and all the golf carts as well as everything that you have at the golf course is being taken care of. But again, keep in mind, it's at 50% capacity only. So that's something that we need to keep in mind, making sure of that. Any other questions?
What long-term effect, if any, does the Myrna COVID vaccine have on one's DNA?
I will let Dr. Anzandula answer that.
So these vaccinations were approved on an emergency basis. Unlike other vaccinations that have been studied for a year, 2 years, 3 years or more, we had these things pass through very fast to get the vaccine out there to save lives. And the law provides certain provisions for us to get that under emergency use authorization. Because of that, we don't have long-term studies yet. We're still learning. Studies are ongoing. We're learning more and more. As far as we can tell, there is no effect on human DNA with the vaccine. This works on messenger RNA, not DNA. So the answer to the question is we don't know, but we believe that there is no effect or impact on human DNA.
Any other questions?
Can you tell us if our parks are open to the public? If so, which parks are open?
All of our parks are open to public. So, and again, just to be cautious with it, to my knowledge that we haven't closed any of our parks. It is open to all the public, but keep in mind, keep the social distance, wear your mask, and wash your hands or use sanitizers, especially if you're using our park. So those are the things. So for anyone in Missouri City, any of the city's parks and all of the city's parks are open to public. Any other questions?
Do you know if the 10 maximum capacity of people to get together is still in place?
You know, we're continuing to follow the state guidelines. And the last guideline that, as to my knowledge, and working with city manager and other city council members, is that 10 is the maximum of capacity that we can have for a gathering. So that is the reason why even the city council meeting that we have, most of us are taking it through Zoom, and staff, and as well as people who are presenting are also taking it through Zoom. So we want to make sure that not only that we follow within those guidelines, but we're keeping our staff as well as anyone else safe during that process as well. Anything else?
Is Missouri City in a position to secure vaccines for residents, or is that limited to counties?
The county, to my knowledge, have Access Health, is who they are, coordinated through that process. City like Missouri City is not a premier a city that we have any contract to hold vaccinations. We're receiving vaccinations. Not to my knowledge, and we're not. At some capacity, I think I've asked the city manager along with the city communication department to look at that and to see that if that is something that we can do. And then it gets into the issue of how do we store it. Glen Lakes Pharmacy, Dr. Mona Finley, have offered that if we do end up going that route, she'll be able to store some of it. But at this point today, to answer the question, we're not. Anything else?
Are there any departments within the city that are closed due to COVID-19?
Basically, all of our departments are open within City of Missouri City, except for the City Hall. And again, as I talked about earlier, the reason for the City Hall closure is because we're trying to prevent public from entering. But places such as, your permits, your planning, all of those are open, where where a resident could walk in or a potential business owner can walk in and request whatever it is that they need. Of course, there are social distance and wearing masks, but those departments are open except for the City Hall. And that's part of the reason why, again, we don't hold city council meetings anymore in the council chamber, which is behind me, and we're taking that off through Zoom. So individual council members, individual staff members are at their house or conference rooms or wherever they are, so they can partake in those conversations. And we are continuing to do the city business as we are required to, and getting things done for the city.
There was a question about what's the phone number to call for the permits department, and that's 281-403-8600. And then we have another question. What is the link again to register for the vaccine at Glen Lakes Pharmacy?
It's tiny, Tiny, URL.com/GLP, Glen Lakes Pharmacy, vaccine with 2 C's. Again, that's tiny, URL.com/GLP, vaccine.
I'd like to have Councilmember Clauser come up one more time to put those websites out there to you all as you're viewing this, so this way that we're clear and you heard it again. So and as you go back and watch this, if you do, that is clear. So I just want to make sure that I invite her to just say this one more time.
So on your mobile phones, which we all live by our mobile phones now, that's probably the easiest way to access information. If you'll download the app MCTX through your Apple Store or Android, that is one way to keep updated. Obviously, going to our website, www.missouricitytx.gov, and then through the various social media platforms, Facebook, Twitter, Instagram, YouTube, and Snapchat. And you can follow us at Missouri City TX. That's how you can follow us. So please, we've invested a lot of resources in making sure that we update you through various channels. We know everybody receives information in different ways. So please, you have that information readily accessible to you through these several ways, and also through Facebook, as many of you are looking. So thank you, Mayor.
Thank you. Any other questions?
Can you register if you are under 65 and not a healthcare worker, or do you wait until you are qualified?
To register through Fort Bend County or any of these formats that we're talking about? No, I mean, you can register at any time. I mean, you can be 65, 40, 70. I would think that you should be able to register. Now, keep in mind that the queue of how you get called for this, there will be age restrictions or what have you that's being done. So that's how they would get called. Any other questions?
Glen Lakes Pharmacy, can you come again and please provide your phone number, your address, and the tiny URL one more time?
Okay, so we're located at 3640 Glen Lakes. That's just right next to Lowe's here in Missouri City. Our phone number is 281-261-8278. Our email address is CVD, coronavirus disease, GLP, Glen Lakes Pharmacy, @gmail.com. We're open from 9 a.m. to 6 p.m. Monday through Friday. And you can register again at tinyurl.com/GLP vaccine.
I just want to clarify something. And like the mayor said, anybody can register. In fact, you don't even have to be a resident of Fort Bend County. Anybody can register. This is for all Americans, although we would prefer to take care of our own people first, but that's not how the law works. I do want to point out, though, that although you can register, you're not going to be eligible for a vaccine if you do not fit into Group 1A or 1B. And as I pointed out, 1A is the first responders, healthcare providers, EMS, staff and residents at long-term care facilities like nursing homes. 1B is non-occupation based, which means that basically you got to be 65 years or older, or you have to have one of the medical conditions listed on the website. So you can register, but they're going to catch the 1B and 1A group, 1A and 1B group first. As far as the 1C group and the ones that follow, those groups, it may be a while. It may be not till early summer. However, that may change. If they ramp up the distribution of a manufacturing of the vaccination, it wouldn't surprise me if we can start rolling that out a lot earlier than early summer. But that's going to be up to the federal government and the manufacturers that are making the vaccine, and also other pharmaceutical companies that are coming on board and having their vaccinations approved. Thank you.
Any other questions? Now, thank you all for watching this second live version. As Councilmember Clauser talked about, that if we have any emergent issues, that we will come to you live again before the next update, which will be in 3 weeks. But I want to take this opportunity to thank all of you for watching this. Thank you all for your questions. Thank you for your comments for us. And please continue to let us know if there is anything that we can do to better these live sessions as we go forward. If there are any particular questions or anything else other than what we're doing that if you'd like to see, please continue to let us know. I want to take this also an opportunity to thank our speakers, Dr. Joe Anzandula and Dr. Mona Finley, our acting fire chief, Mario Partida, and our council member, Jeffrey Boney, as well as Lynn Clauser, for taking their time out of their busy day to come in and be live in front of you to answer these questions. And as you can tell, that we're very focused on what's going on with City of Missouri City. We want to continue to work for all of you to make sure that we keep our safety number one safe. And once again, thank you to our police officers, our fire, and our responders of all kind for taking your time and to make sure that our citizens are safe. And lastly, to all of our healthcare employees and healthcare workers that live in our city, big kudos to you. Thank you so much for being the front line out there today and making sure that you're taking care of patients throughout it doesn't matter from Missouri City or anywhere else, that you are out there putting yourself and working hard. And want to once again take this opportunity to thank our Director of Communications, Stacy Walker, and the entire team for taking the time to assist us by putting this live feed together and helping us to answer some of these questions, making sure that we come to you with more details. So as you watch this, as we end this program, as you watch this, please continue to let us know in comments how we can better serve you at the next one that we're putting to do. Thank you again. God bless you. Stay safe. As Dr. Joe Anzadula said, the 3 W's: wash your hands, wear your mask, and watch your distance. And those are the 3 key elements that we need to continue to do to make sure that we're safe in our city. God bless you.